What's up, y'all? It's your girl, Cheris Mama, here with episode 2 of the Gut Feelings series, where I am talking all about my journey with my gastroparesis diagnosis and really what listening to my gut looks like, both physically and spiritually. So, this is episode 2, and we're going to talk all about what gastroparesis actually is. Now, full disclaimer, I am not a medical professional. You are seeking any type of advice, please go find one of them because I am not that. This is purely for me sharing my experience, my research, what I have found out, what is working for me. Okay, so let's get into what exactly is gastroparesis. Gastroparesis, if you couldn't already tell by the name itself, gastroparesis, it is a paralysis of the stomach. It is a long-term condition where stomach, and excuse me, I have my notes right here. So if you see me looking down, just making sure I get everything right. Okay. Don't want to lead y'all astray. Okay. Gastroparesis is a long-term condition where your stomach essentially does not empty into the small intestines, or it does very, very slowly. And it happens when your nerves and muscles aren't moving. They're not contracting. Essentially, you have no gastric motility. When you eat food, it goes through your esophagus and it should go down into your stomach, and there should be contraction there to move it through your intestines. With gastroparesis, that isn't happening nearly as quickly as it should, if at all sometimes. And so that's important to know because it's not caused by any physical blockage. Like there's nothing there that is physically stopping the food from going down. It is literally nerve damage. And because of that, it can impair your digestive process and you can have poor nutrient absorption. So that would explain why I was telling you guys I was trying a new, what was it? I tried a new collagen powder and I had tried a new creatine. I had tried creatine and it was not digesting. And part of having gastroparesis, you have to stay extremely hydrated because everything already kind of gets stuck. So with creatine, you have to drink a lot of water. It makes sense why it was just sitting in my stomach. I was feeling bloated and all those other things because my stomach was broken. So getting into kind of the symptoms, you can feel full really fast, like having a small amount of food. Like you can have a huge appetite. It's like your eyes are bigger than your plate almost, or bigger than your stomach. And it's like you have a couple bites and like you feel full and you can't finish eating, even though your stomach isn't truly full just yet. Throwing up food that you've had before, hours after or time after, having nausea, pain in the stomach, bloating, comfort after eating, weight fluctuation, and something else called a vasovagal syncope, which is essentially when you faint or get really low blood pressure because of your vagus nerve being overstimulated, or your parasympathetic nervous system kind of, you know what I mean, resetting. And that was exactly what was happening to me. I was telling you guys, I was getting really hot, really sweaty, losing my hearing, my vision, and I would start to faint and then throw up. And then it was like a whole reset. I was perfectly fine. I was able to eat afterwards. My vagus nerve was trying to reset, saying like, hello, it's not working here. It's kind of like tripping the breaker, so to speak. And so what causes this? Because trust me, I was trying to figure out, what did I do? How did I get here? And we'll kind of get more into how I believe I got here in episode 3 when we talk about the vagus nerve, the parasympathetic system, and its role in your overall nervous system, which is connected to the solar plexus chakra. So we're going to connect those dots in episode 3. But for now, the vagus nerve can be damaged on its own. It's a nerve. And that is usually called idiopathic, which is when you just don't know the cause. But one of the most common causes is diabetes, which I was screened for at the hospital. I was not pre-diabetic, no diabetic concerns here. Having previous stomach surgeries, which I have not, viral infections, pain medications like narcotics, and also I found out that GLP-1s can actually also cause gastroparesis. All of these causes, none of them were mine. It just kind of came out of nowhere, and that happens actually to a great percentage of people who have gastroparesis. And when we talk about how common the disease is in and of itself, or the disorder or condition, Out of 100,000 women, only 10 men will have it, and about 40 women will. So it's obviously more common in women than men, but it's less than like 1% of the population. It's very, very small percent. However, if you think that you may be symptomatic and you are having questions, I highly encourage you to seek medical attention. Do not go untreated. You can end up dehydrated like I did. You can end up with malnutrition and having other issues. You can also, that food sitting in your stomach can ferment and it can cause a bacterial growth in your stomach. So you don't want to end up having those kind of issues. Okay, so if you have questions, please go see somebody. And the way that they'll diagnose you, kind of touched on it in my first video. So there's like a twofold. First, you do an upper endoscopy, which is when they stick a camera down your throat. You get put to sleep, and they just look for any abnormalities. They're looking for any growths, all kinds of stuff, child. I don't know what they're looking for, but I know they're looking for something. Again, like I said, it's not caused by a physical blockage. So that's what they're looking for. What can be in here? And they found nothing. So once you pass that or have that first study done, then the next test will be a stomach emptying test. Will they give you they give you a meal with radioactive material in it, which is crazy to think. I opted again for like a protein shake, and you can't taste it or anything, but you get put under a machine that reads the radioactive material at the like 1 minute mark of you consuming, 1 hour mark, 2 hour mark, and the 4 hour mark. And now in a healthy person at the 2 hour mark, you should have less than 60% of the meal left in your stomach. And at 4 hours, you should have less than 10%. I was not at less than 60% at the 4 hour mark. So I severely failed that stomach emptying test. And that's kind of how they kind of come to that deduction. Okay, this is what's going on. As far as like treatment or anything, there's a couple options. Of course, I chose the homeopathic way, which again, we'll touch on in episode 3 when I talk about the vagus nerve, parasympathetic, and the solar plexus. But you can take medication for nausea if you're someone who experiences a lot of it. There's medication to stimulate the gastric motility in your body. And then I've seen some people on Reddit talk about they've got Botox in their vagus nerve. I've seen that there's like an electric stimulator. It's kind of like a pacemaker that you can put inside your stomach. So there's options. And then for like the more severe cases, I have seen people with feeding tubes. God willing, that I am managing this well enough and able to maintain my weight and all of that fun stuff, for the long term. So as we get into, management and stuff, I'll talk more about my diet, which will be in episode 4. But just for like overall, in a nutshell, baby, all raw fruits and vegetables, I had to let go. Anything high in fiber and fat had to let go. Okay, lots of fluids, and I have to eat smaller meals that I like over chew to help the processing. It's been a journey. But again, we'll talk more about that in episode 4. Episode 3, we are going to dive into the vagus nerve and how it's connected to the solar plexus and how I've been managing going the holistic route with this diagnosis. So I'll see you then. Thank you guys so much for watching. I appreciate all the love and supports. See you in the next one.